In Contact with Lansing, I'm Gary Austin. On the show, we have Dr. Aajay Shah. He's a cardiologist, a specialist in heart health. And Dr. Shah, today, it seems like employers are becoming more and more aware how important it is that their employees are as healthy as can be.
Gary, I'm glad we are sitting today. We have realized over the last 50 years in Western medicine that things have not worked as well we intended. And I think part of the reason it hasn't worked because the physicians have taken the charge of helping people. And there's nothing wrong with that. Physicians go to medical school, they're trained, and they understand how to take care of disease state. But at the same time, what my gut feeling now is that if we have to improve health of our country, we have to do something different. And I'm in practice for about 20 years now. So I'm telling from my personal experience. So let's see how we can do it. We have physicians, we have patients, we have nurses, we have employers, we have employees, we have insurance companies, we have government, we have you, Gary. All of us are part of this team. And it's a team effort. Just like any other, for example, basketball, we cannot have one player win the game. It's a team effort. And I think in Western medicine, that hasn't been completely missed out. I see so many patients that come and see me first time, and they're on a medicine for 5 years. They're not even many times aware when to take medicine, why they are taking it, what are the side effects, what are the drug interactions, and why this thing happened. I think this thing happened partly, Gary, because physicians have taken the whole charge. So how can we change it? I want employers to take charge. I want church to take charge. I want temple to take charge. I want radio stations to take charge. I want TV stations to take charge. I want everyone to take charge to help people understand that if they are healthy, it's not only good for our society, our country, and the world, but also for the place they work. We have multiple statistics and data available. If you look at the Seattle, many businesses want to move to Seattle. Why? Because people who live there, they are not only healthier, but they want to go to the work in the morning fresh, happy, with a good sleep. And they are definitely much more creative people than I know in many parts of the country. So I think to me, it's intertwined. Medicine, being healthy, business, family values, all those things are not separate things. They are one joint feeling. And I think doctors have forgotten that. Doctors haven't realized that employers are equally part of their practice.
Dr. Shah, it sounds like it's all about asking questions and being informed.
Absolutely. The way I put it is that all of us, when we go to change oil in the car, which we do so often, every 3 to 6 months, we always go and ask questions that, do we have to change the brake pads? Do we have to change the windshield fluid? If you change the oil, what kind of oil are you going to use? So when we go to our physician, which is nothing different than going for an oil change for our body, it's a maintenance, it's a preventative visit. So when you go as a patient to your physician, make sure you have a list of items you're going to ask. Make sure you take notes. And I'll tell you a great doctor secret here, Gary. If you go to see a doctor, and if you take a pen and paper, you get better care. You know why? Because when doctors see that you are writing and taking notes, doctor gets excited that this person wants to be part of his or her own care. And I think, in my opinion, the doctors right now are become slightly kind of have that slight apathy because patients come and they're not interested in their own care. Why would a doctor be interested? But if a patient goes and asks questions and have a list of questions so doctors don't feel that patients are wasting their time and take notes, I can tell you every patient will get better care by just simply taking pen and paper to their visit. And if you forget the pen and paper, ask the secretary when you walk in. Doctor's office can give you pen and paper. You sit in the room, and as doctor is talking, look in his eyes or her eyes, but take the notes. you will get better care instantly, and it's not going to cost you anything more than you just paid for the doctor's visit.
Dr. Shah, do you think too many of us today simply take our health for granted?
Absolutely. I think, God has given us great body. And, when I talk to some of the medical students and some of the nurses, they say, Dr. Shah, and for that sake, any doctor, when they ask, it must be very, very scary feeling to work on people's heart or, for surgeons, people's knees. You know what my response is, Gary? God is great. So the point I'm trying to make it to you is that God has given us a great ability to heal ourselves. But at the same time, there is limit to it. Many people, they assume that this ability to heal themselves is indefinite. To answer your question, many people take it granted that they will just be fine because body takes care of itself. Yes, it does, but to an extent.